Today we will discuss about disease 1 to 6. Those disease 1 to 6 are skin rash. There were 6 viral enanthems known as first, second, third, fourth, fifth, and the sixth disease. Enanthem is an eruptive widespread rash. First disease is measles, second disease is scarlet fever, third disease is rubella, fourth disease is Duke's disease, fifth disease is Parvovirus B19, and sixth is Roseola Infantum. So let's see each of them separately. First disease is measles. As you know, measles is caused by measles virus. It is highly contagious via respiratory droplets and sometimes starts 10 to 12 days after exposure with fever, coryza, and conjunctivitis. Copic spots are grayish-white spot on the buccal mucosa. They appear 2 days after the fever, but before the onset of skin rash. Measles rash starts on the face, classically behind the ears 3 to 5 days after the fever. It then spreads to the rest of the body downward. The rash is an erythematous macular rash with flat lesions, so it is maculopapular. Measles is self-resolving after 7 to 10 days of symptoms, and children should be isolated until 4 days after their symptoms resolve. 30% of patients with measles develop complications. The potential complications include pneumonia, diarrhea, vomiting, dehydration due to diarrhea and vomiting and poor intake, encephalitis, meningitis, hearing loss, vision loss, and death. Second disease is scarlet fever. Scarlet fever is caused by an exotoxin produced by Streptococcus pyogenes or group A Streptococcus. It is characterized by red-pink, blotchy macular rash with rough sandpaper skin that starts on the trunk and spreads downward. Patient can have red, flushed cheeks. Other features include fever, lethargy, flushed face, sore throat, strawberry tongue, and cervical lymphadenopathy. Treatment is with antibiotics, mainly penicillin, for the underlying streptococcal bacterial infection. Children should be kept off school till 24 hours after starting antibiotics. Patient can have other conditions associated with group A streptococcus, such as post-streptococcal glomerulonephritis and acute rheumatic fever. Third disease is rubella. Rubella is caused by the rubella virus. It is highly contagious and spread by respiratory droplets, and the symptoms start 2 weeks after exposure. It presents with a milder erythematous macular rash compared with measles. The rash starts on the face and spreads to the rest of the body. The rash classically lasts 3 days. It can be associated with mild fever, joint pain, and a sore throat. Patients often have enlarged lymph nodes, lymphadenopathy behind the ears, or post-auricular lymphadenopathy, and at the back of the neck. Children should stay off school for at least 5 days after the rash appears. Rarely complications include thrombocytopenia and encephalitis. Rubella is dangerous during pregnancy and can lead to congenital rubella syndrome, which is a triad of deafness, blindness, and congenital heart disease. Disease 4 or Duke's disease. This is what we now refer as staphylococcal scalded skin syndrome or Ritter's disease. This disease is caused by epidermolytic or exfoliative toxin producing strains of Staph aureus. However, others believe it might be misdiagnosed of either scarlet fever or rubella and therefore a non-existent disease. The term was dropped from medical textbooks since 1916. The fifth disease is erythema infectiosum. Parvovirus B19 is also known as fifth disease. Slapped cheek syndrome, and it is caused by the Parvovirus B19 virus. Parvovirus infection starts with mild fever, coryza, and non-specific viral symptoms such as muscle aches and lethargy. After 2 to 5 days, the rash appears quite differently as a diffuse bright red rash on both cheeks, as though they have slapped cheeks. A few days later, a reticular mildly erythematous rash affecting the trunk and the limbs appear that can be raised and itchy. Reticular means net-like. Erythema infectiosum is self-limiting, and the rash and symptoms usually fade over 1 to 2 weeks. Healthy children and adults have a low risk of any complications, and are managed supportively with plenty of fluids and simple analgesics. It is infectious prior to the rash, but once the rash has formed, they are no longer infectious and do not need to stay off school. When we see complications of erythema infectiosum, human parvovirus B19 infects erythroid cells, causing a reticulocytopenia that lasts 7 to 10 days. A healthy host experiences no consequence since the normal lifespan of RBC is 1 to 20 days. In patients with a background of shortened RBC survival, such as hemolytic anemia, an acute aplastic crisis occur. This includes sickle cell anemia, hereditary spherocytosis, thalassemia, G6PD deficiency, pyruvate kinase deficiency, and autoimmune hemolytic anemia. Those people suffer from aplastic crisis due to Parvovirus B19 infection of erythroid cells, which causes reticulocytopenia. The sixth disease is Roseola Infantum. Roseola Infantum is also known as just Roseola or sixth disease. This is caused by human herpes virus 6 and 7. Roseola has a typical pattern of illness. It presents 1 to 2 weeks after infection with high fever that comes on suddenly, lasts for 3 to 5 days, then disappears suddenly. There might be coryzal symptoms, sore throat, and swollen lymph nodes during the illness. When the fever settles, the rash appears for 1 to 2 days. So the difference between measles and the Roseola Infantum is, in Roseola Infantum, when the fever stops, the rash starts. But in measles, rash and the fever overlaps for a few days. The rash consists of a mild erythematous macular rash across the arms, legs, trunk, and the face, and is not itchy. Children make a full recovery within a week and do not generally need to be kept off nursery if they are well enough to attend. The main complications to be aware of is febrile convulsion due to high temperature. Immunocompromised patients might be at risk of rare complications such as myocarditis, thrombocytopenia, and GVS.